Okay, I'm going to call back my doctor's clinic because my new doctor, they called when some of the test results were showing high results, and I looked at it on the website Healthy Life. And in fact, for about 3 days, if not more now, I'd have to go check again. I couldn't, after that time, I couldn't access Healthy Life, the website, so I'm not sure what's going on there. So I'm going to call back the clinic, but they had called saying it's not a rush right now, but the doctor would like to talk to you about your test results, and that's where I went to see, right, what they are. And and I said, well, my appointment is less than a week, so I can wait. But my appointment, according to what they wrote down, is at 12:50 today on Earth Day 2026. 12:50, but my doctor herself called, about an hour ago or less, and saying, I'm calling to follow up with your blood pressure, and it's high, and I assume she'll give me medicine. But the thing is, though, is, my schedule matters also. You can't be late both first times, and then the third time on the phone, you're hours early. So I'm going to call and say, who needs to kind of maybe learn how to be more, patient-centered here, which is, again, the questions I didn't get to ask, where she goes on a scale of 1 to 10 when it comes to those things. First thing I'm going to say, though, is I'm sorry, but the first thing I want to say is I didn't get a call from who you want to refer me to because you want to make sure you're covering your bum, but really it's because you don't trust me, and it causes delays to my driver's license medical, right? Because you think maybe because somebody prescribed something that's usually used for this. I didn't tell her this, but a lot of doctors don't even know that medicine, and some use it for something totally different. It's often used for shift work. It's used for attention disorders of some kinds, and some pharmacists don't have one patient who get this, so that means they have to look it up. They're not familiar with it. Some doctors aren't familiar with it, but it's been around since the 70s. I don't want to give her a course on medicine. I want to help her kind of feel good about herself if she wants to refer me for sleep pattern specialists, but they have to do it quick because I made a promise when I did reach Road Safety BC that that they would get it for my appointment, which was last week. So they didn't get it yet, and I didn't get this referral. So that's the first thing I want to mention. And if she shuts that down, then I'm going to say, I think I'm going to shut you down right now, and let's go through these questions to assess if we're a good fit, because I kind of need a doctor that's patient-centered. And if I get kicked out of having a doctor, not a big deal. Especially after...
Good morning, doctor's office.
Oh, hi, it's Martin here. How are you? Martin Parizeau?
Hi, I'm good. How are you?
Good. The doctor called, but is it me or isn't my appointment at 12:50 today? My phone appointment with my doctor?
Martin, you have an appointment booked between 9 and 12 for a phone call.
Oh, on the paper it says
I'll let her know
12:50.
you called back and she'll try again.
So I should wait in the meantime? She wants to...
Yeah, she'll try again for calling you. It looks like she just wants to follow up on your blood pressure.
Okay, so she wants the appointment earlier than 12:50, and I should just sit on a chair here and wait because she might call me soon?
Oh, just keep your cell phone with you and then she'll try again.
Okay, it's just that I'm kind of busy doing things, cleaning up here, and anyways, maybe I'll wait 10 minutes because maybe she will call right away, or...
Okay, yeah, I can't say when she tried again. She has patients this morning, but I have let her know that you call back and she will try again at some point.
Okay, because I would...
can't guarantee time, I'm sorry.
Because I was going to sit down at the 12:50, which was my appointment time, but...
Okay. We don't give exact times for phone calls, so I'm not sure what happened there. We either say it's between 12 or 9 and 12 or 1 and 4.
Okay, so... Okay, hopefully I'll be available, but maybe, phone appointments might not be good if she's in town and I can have an in-person appointment instead that would be on time, because I'm just trying to plan my day today.
Yeah. If you do miss the call again, you can always call us back and we can book you in for an in-office visit if that's better.
Okay, thank you.
No problem.
Okay, bye-bye.
You're welcome. Okay, bye.
So, I mean, staff don't work in clinics if they are not doctor centered, right? It's all about them and the way they want to do things, which is more often than not patient centered. And I'm gonna say again. So when she calls, if I'm here and I'm ready to turn on my computer, because I do want to record it. Didn't record anything in the first in person, but I do want to record this. There's some things in this week's paper, the Northern View, I think it's called, and it mentions Northern Health wants to do a survey until July. And of course, what I can do is I can make sure that my vlogs on Northern Health are brought to the attention of their, chief medical officer and say, well, this is what I learned, and let me know on a scale of 1 to 10 if you thought this interaction in these recordings appear to be patient-centered or not. And, so again, I wanted to ask, do I have current diagnosis when you have time to look in my file? And if you don't have time to look in my file after, that long, then, maybe something's wrong with how much time you're willing to invest in a patient. How patient-centered are you on a scale of 1 to 10? Do you believe patients should be a member of the medical team? 1 to 10. Answer 1 to 10 on what level they should be. And if it's not 10, it's pretty scary. Your ability to receive and apply feedback, 1 to 10. And so far, let's see if she says, because I gave her the feedback, listen. Because, when students gave me feedback in my driving school, and I don't need to be a doctor of driving for this, driving education, but if they gave me feedback, I'd write it down in my notes, and they'd see me do it, and then I'd say, I give you permission to call me on it next time, and that's how behavioral changes can happen. But the thing is I don't want to give them a chance to say you did it again, because if I see that their feedback has value and it doesn't impede what they're learning with me explaining how it might, then yes, the way they learn and the way they want to feel respected, and it's important, right? It's important what works for them, right? Because I'm providing a service, not a product, a service. On a scale of 1 to 10, what is your level of advocacy for your patients? And on a scale of 1 to 10, in what way do you perceive as having accountability as a way of life? So anyways, she'll give numbers, and I want to record these numbers, right? Either written down or on this video. And because when the time comes that, I have to say, well, you kind of said on a scale of 1 to 10, then you said your answer was 8, right? You believe 8 that the patient, and I could follow up with a probing question like, what would be the other 2 that's missing? How do you explain it? And it could be somebody who's, in a coma or something like that, right? Or they have mental illness to the level where they don't see up and down. They don't live in a reality, right? And there's a lot of politicians like this today. So, and medical practitioners as well, I'm sorry to say.